not so deep. So simply, these are the layer of the buccal area. From the skin deeper, we have the buccal. We don't have bone here. The platform of this area is the buccinator muscle. So simply, what we'll have in the buccal space or the buccal area, we have the facial artery and the facial vein. So when you inject, always superficial, always. When you inject this area, always. No one inject like that. Because we have the facial artery here and we have the space here, just always, if you want to fill this area, just lateral to the oral commissure, use always a superficial level of injection. Perforated, maybe later on we'll talk about it, it's more advanced. One about the facial artery when we inject the jawline. When you inject the jawline, you have to put in consideration the origin. As I said before, the facial artery is just coming in front of masseter. So when you inject the jawline, you have the main trunk, the main origin of the facial artery. So ask this patient to clench her teeth and just to feel the anterior border and put your finger 1 centimeter just anterior to the margin, anterior margin, will have the facial artery where it enters inside the face is the facial artery 1 centimeter just in front of the masseter muscle. So, if you divide the jawline in two main parts, from the anterior border till the angle of the mandible, which is posterior, and from the anterior border till the marionette line. So let's talk about when you like to inject jawline in the posterior part, from anterior border till the angle of the mandible. These are the posterior part of the jawline. What will be the layers? These are the layers. Starting from the skin to the mandibular bone. Okay? I don't want to go through these layers, it's more advanced. Okay? So where will be the arteries? We have masseter anterior border and have one mandibular angle. Add just in the masseter anterior border, we have here the facial artery and facial vein. And just at the border of the mandible, we have marginal branch of mandibular nerve, which is the motor nerve. These are the main structure. So by all means, if you want to inject posterior to the anterior border, just make a mark on the anterior border and goes behind 1 centimeter and start to put your boluses just at the bone. You are safe. Okay? Or if you want to inject, you can inject at superficial level because the facial artery is coming from a deepest level, which is the bone. So if you want to inject the posterior part, please inject 1 centimeter behind by needle on the bone. You are safe till the angle. Or you can inject superficial level. So what about the anterior part, which is from the marionette, from the anterior border till the marionette line? This is the anterior part of the jawline. What will be the layers? These are the layers. Okay? Of course, we will not find here the masseter muscle. What are the main structure? At the masseter anterior border, again, we have the facial vein and facial artery. And just the marginal branch of mandibular nerve passing on its way till it reaches the chin. These are the main structure present. So if you want to inject here, no way to inject deep. And let me tell you, in this area from the anterior border of masseter to the marionette line, this is the jowl area. For me, it is no-go area. Sometimes some doctors like to inject here at a subcutaneous level if they want a better definition. I can do it in a patient without, if she has not any kind of jowling here. If she has a jowling, please, this is a no-go area. So in a middle age or older patient, always in the anterior port of the anterior margin of the masseter, do not inject this area. If in a younger patient you want to do more definition, you can inject it by needle at superficial level, because here deeper level we have the facial artery and facial vein. So simply, this is the main branches. This is the map for me. When I inject, I should put in consideration, this is all the areas or all the courses of arteries I should put in consideration. So we have to know very well, we have put the maximum possibilities of the presence of the artery. So now if I want to just resume all these areas, the facial artery depths of injection, at the origin, where we have to inject, the artery is deep. So where you inject? Subcutaneous. Going up, if I want to inject, we have the inferior labial artery. So I have to inject subcutaneous, still in a deep level of the artery. If I want to go up in the buccal area, I should inject subcutaneous level, not deeper. Nasolabial fold, always still coming up, always superficial subcutaneous, and at alar area, either at the bone or subdermal level. When I'm talking about the medial area, here, just the medial side of the nose, no injection. No injection. Why? Angular artery. Here, it's the landmark of the angular artery, just the medial side of the nose. So if you put your needle here, either superficial or deep, you are going through the angular artery. When you want to inject this area, go from by cannula, laterally, and very superficial level and very small amount, and just go out. By needle, please no way to inject the needle to the nose because the artery here is very superficial. Okay, the last area will be the chin. The nose will be more advanced. I'll talk about the chin. What about the main arteries when you inject the chin? Mental artery, labiomental artery. We have some mental artery, and we have the infralabial artery, or inferior labial artery. So the chin, I divide it into 3 segments. We have upper, middle, and lower chin. It is not one area. What about if you want to inject, if you want to do contouring or projection of the chin? You inject here on the bone. This is the lower part. This is artery, the forgotten artery, which is the submental artery. It is one of the main large artery coming from the facial artery. Where will be the course? This is again a picture of submental artery.